Good evening. I'd like to welcome everybody to the August Health Committee meeting of the Albany County Legislature. I'd like to call the meeting to order for the August meeting here. If you just give me a second to pull up the agenda. Before we start, Rebecca, could you call the roll of the members of the Health Committee?
Sure, Mr. Chairman. Mr. Joyce?
Present.
Reedy?
Here.
Beston?
Here.
Collins?
Here.
McLean Lane? Here. Miller? Moriello?
Here.
Ward? And Willingham?
Here.
7 present, Mr. Chairman.
Thank you, Rebecca. Under previous business, can I get a motion to approve the previous meeting minutes?
Motion.
I have a motion by Ellie McLean Lane, second by Mr. Beston. All in favor?
Aye.
Aye.
Any opposed? Unanimous. Okay, under current, we have number 2, establishing the Mind Your Health training program to provide certain county employees mental health first aid training. I know we have sponsors, both Ms. Willingham and Lakakis. Would either one of you like to make comments to this?
Wanda, would you like me to?
Oh, absolutely. Absolutely.
All right. Well, resolution number 301 is a measure. It's called Mind Your Health Training Program, and it is to help the forward public-facing employees to get training to help to identify which of our employees would be helped by training to address mental health issues in the people that they are coming in contact with. And this will make a list of the employees that are eligible for that, and then they will identify a vendor with the help of the mental health and the human resources commissioners, and then they will come to us and let us know how much that is going to cost. I understand that Dr. Giordano and Jennifer Clement are completely on board with this, and some of the things it's going to help with is to identify, common signs and symptoms of some of the mental health challenges like substance abuse, suicidal tendencies, trauma, how trauma affects people's behavior, people that are in crisis, self-care, and how to deal with people who have helpers and, assistance, and, the best way to just communicate and to identify things so that they can help everybody to stay safe.
All right, thank you, Ms. Lakakis. Any questions for the members?
Is it okay?
Sure, go ahead. Go ahead, Ms.
All right,
Willingham.
thank you. When I first saw this, there was a young woman who made national news in that her parents had called for help. And the police were called, and they came in the way in which they handled her. But the young woman said, if you take me, I'm going to kill myself. And she wound up doing just that on the way. And so I personally do not believe that the officers had any intention of any harm coming to that young woman. But the fact that she was crying out and saying that she was going to do harm to herself. Locally, I can't tell you the number of people that I know are having mental health challenges right now, which even involve being afraid to return to work and the anxiety that they're having to deal with. When we think about the homeless people that we have difficulty in reaching, if there were people who were trained to do come in contact with different folk in various situations, it would help tremendously. We also realize too that our mental health workers are overtaxed right now. And so any help that we can give to, as we call people who are human services and meet with people on a regular basis, that would help them to be able to identify and recognize someone that may be suffering from mental health issues. This would be a tremendous help. But it also is that incident that I'm talking about would also address where it says here, addressing mental health issues before a difficult situation escalates to a tragedy. I myself had to listen to someone who had been talking to me for a while. And it was the very last time that they spoke to me that I actually heard what they said. And they said, I'm having anxiety. And I asked them if they had, finally I asked them, have you been receiving any help? And they said, no, but there is something wrong with me. I don't consider myself a trained person in recognizing someone that may have some mental health challenges, but I do know when it's apparent, very starkly apparent to me, then that's when I actually heard what this individual was saying. And I thought about the young woman who had died under those circumstances when the police came and got her. So we do know there are a lot of young people that are suffering from mental health challenges right now. So I applaud Dr. Giordano and all of the work that his people are doing, and also the health department. But this is something that I think is sorely needed. And I'm just asking for everyone to support it and realize that this goes across so many different genres that, you know, we should really do something about, whether it's people who are suffering from drug abuse, whether it's the people that are incarcerated, whether it's young people that are in school, whether it's high school or even our small children. I just say that, you know, let us please pay more attention to the needs for mental health, this mental health first aid training. Thank you.
Thank you, Ms. Willingham. Are there any questions from the committee?
Mr. Chair, I had my hand raised, but I'm not sure if you can see it. It's always challenging.
Didn't see it. Go ahead, Ally.
I apologize. Thank you very much, Mr. Chair, and thank you very much, colleague Willingham, for really enunciating how challenging this situation is. There was a new number called 988 where anyone can call to get support for mental health and as well substance use disorder challenges. This is something I think the county really needs to pay attention to and start pushing forth and putting it out into the community that they can call. And also, please know that former member Phil Steck is now chair of the Committee on Alcoholism and Drug Abuse, and he is ready and willing to hear local experience on how he can best address this. That's all.
Thanks, Ms. McLean Lane. Are there any other questions from the committee on this number 2, this item?
Chairman?
Go ahead, Mr. Grimm.
Thank you, Chairman Joyce. Yeah, the question I have, it's funny, in the gun control debate, the one thing the Democrats and Republicans agree on is the need for mental health. So it seems to be people ought to be trained in how to handle mental health issues. The only question I have is on the findings in here, because there isn't a fiscal impact statement. And basically, just based on what Ally said, I wonder if there's state money available that that will provide mental health training for us, as opposed to us issuing our own RFP. Because it seems to me we're going to need, this is a recurring expense that we're going to have year by year, and it either has to be, I think, in our county budget, or there must be some funding with the state perhaps. So that's, I guess my question is, how do we fund this, this idea?
Currently, we don't know how much it costs because we've got to know the universe of people that will be good candidates for it. So yeah, for sure, the executive branch and staff and legislature do an excellent job of securing grants when they're available. So we will definitely always look.
Yeah, no, I think it isn't unclear. It is unclear how much we're talking about here in terms of money. But I do think this, if there's anything the state is interested in, it's in mental health. So this is like a great opportunity for us, it seems.
Agreed. Thank you, Mr. Grimm. Any other
Thank you.
questions? I apologize if you have your hand raised. I don't have that screen open, so. Hearing no other questions, can we get a motion to move this?
Motion,
Motion made by Ms. Willingham. Do we have a second?
Second.
Second by Mr. Beston. All in favor?
Aye.
aye.
Any opposed? It's unanimous. Nice work, Wanda. Number 3, public hearing on proposed local law number H for a local law of the County of Albany, New York, preventing interference with access to healthcare facilities. This one, I don't know if anybody wants to speak to this. This is just the public hearing. We're going to probably table number 4, the local law. Do we
I
want
would
to
like to be added. Oh, I'm sorry. I interrupted you.
go ahead, Ms. McLean Lane?
I apologize, Chair Joyce. I interrupted you. I would like to be added to this, please.
Number 3, the public hearing, or number 4, or both?
Both of them.
Okay. Okay, and number 3, get a motion.
Mr. Chairman, I don't know if you can see my hand or not.
I could not, Mr. Moriello, go ahead.
Okay, just a couple of real quick comments. Number one, when I read this initially, I thought to myself, there must be existing legislation that already covers this. And so I asked my staff to do a little research if we could look into this a little bit. And I'm a little bit at a disadvantage because I'm not an attorney, but this is a couple of things that we discovered, that we found. And I just wanted to bring this up because, you know, I'm not one to want to duplicate any legislation, or, you know, we want less government, not more government. So as an example, on I should say letter C of the definitions, the term harass, on the second line, commit or conduct or acts that alarm or seriously annoy another person and which serve no legitimate purpose. Well, that's currently under the penal code, section 240.70, called criminal interference with healthcare services or religious worship in the second degree. And the language is virtually identical to what we have in our legislation. Also, under definition F, the term illegitimate, it's in this legislation as well.
Intimidate.
And, you know, it's also pretty much word for word. So it seems like we have this covered, you know, in other legislation. One other quick comment is that when it comes to actually C, I'm sorry, I think I misspoke before. I was looking at E. Under the definition on C, commit or conduct, or the word harass. This is currently covered under section 240.26, harassment in the second degree. And again, the language is virtually identical, but harassment in the second degree in the state legislation is a violation, where in our legislation, it's a misdemeanor. So, I mean, I'm a little bit confused. It appears that we're covering this in other areas with state legislation. I'm not sure why we're duplicating it with ours. So, thank you.
I would just note, sometimes you want to take an all-encompassing route of making sure that people can't harass other individuals in certain areas that may be covered by the state law, but it just seems that harassment of an individual engaged in making medical decisions is something that should be prohibited. If it's prohibited at the state, it's equally, the state law may supersede that portion in certain circumstances where this law may be necessary to contain that language in certain situations. So I think everyone agrees that the conduct should be prohibited. If it's, you can't be tried twice for the same crime, but if it's prohibited twice, that's just more opportunity for a district attorney to make sure that victims are protected.
Thank you, Mr. Collins. And again, this is just the public hearing for local law number H. Can we get a so we'll end up tabling number 4, the local law itself, until after the public hearing, but can we get a motion to move the public hearing?
Motion.
Thank you. A motion made by Lane. Do we have a second?
Second.
Second by Mr. Reedy. All in favor?
Aye.
Aye.
Any opposed? Okay, the public hearing is moved. At this time, I'd like to ask to table number 4 until after the public hearing. Number 4, the local law itself. Number 8, 2022, local law of the County of Albany, New York, preventing interference with access to healthcare facilities. Can we get a motion to table?
Aye.
You don't actually need a motion, Mr. Chairman. It's automatically tabled pending the public hearing.
Great. All right. Thank you, Rebecca. Number 5, authorizing an agreement with the New York State Government Traffic Safety Committee regarding the Highway Safety Grant Program. And I think this month we have Ms. Witherspoon joining us.
Yes, good afternoon. I'll be representing the Health Department tonight. We also have a Board of Health meeting going on at the same time, so Dr. Whelan is attending that.
Always good to see you.
For this request, we are asking permission to accept grant funding from the Governor's Traffic Safety Committee. I believe this is our 4th time being awarded this grant. We have been awarded $25,000. And this is to continue to promote pedestrian safety in the town of Colony and City of Albany.
Thank you, Ms. Witherspoon. Are there any questions from the committee? And again, if you have your hand raised, just please speak out because I can't see your hands.
Oh, thank you, Chairman Joyce.
Sure.
I just wanted to be added to this. Pedestrian safety is a significant issue in the town of Colony, so please.
Thank you, Ms. McLean Lane. Do we have any other questions from the committee? Hearing none, can we get a motion to move?
Make a motion.
A motion made by Mr. Beston. Can we get a second?
I'll second it.
Second by Mr. Moriello. All in favor?
Aye.
Aye.
Any opposed? Unanimous. Number 6, authorizing the submission of a grant application to the CDC's Closing the Gap with Social Determinants of Healthcare Accelerator Plans grant. Once again, Ms.
Request to apply for the Closing the Gap of Social Determinants of Health Accelerator Plans from the CDC. It will aid in the development of action plans to address social determinants of health to help improve chronic disease outcomes such as asthma, diabetes, and heart disease.
Thank you. Do we have any questions from the committee? Hearing none, can we move number 6?
I'll make a motion.
Mr. Beston, do we have a second?
I'll
Second.
Ms. Willingham, thank you. All in favor?
Aye.
Any opposed?
Aye.
It's unanimous. Thank you. Number 7, amending resolution number 342 for 2019 regarding the overdose data to action grant program.
We were recently notified by New York State Department of Health that we were given a 1-year extension for the opioid data to action grant. We are coming to ask for permission to extend the contract out to another year, ending August 31st, 2023, bringing the total funding to $288,000. And with this grant, we do things like naloxone trainings and help provide linkages to care.
Thank you, Ms. Witherspoon. Do we have any questions from the committee? Hearing none, can we get a motion to move number 7?
I'll make a motion.
Motion made by Mr. Beston. Do we have a second?
I'll second.
Mr. Moriello, all in favor?
Aye. Aye.
Opposed? Unanimous. Thank you. Number 8, authorizing the renewal of a contract for reentry services with the New York State Division of Criminal Justice Services.
Good evening, Mr. Chairman. Thank you very much. If I could just take a moment to just express my appreciation for legislators Lakakis and Willingham's comments about first aid training, mental health first aid training. I think it's a brilliant proposal, much needed. There's a lot of suffering out there. And I think the main point is that we have to take care of ourselves and each other better. And I just applaud the effort. So thank you for letting me editorialize for a moment. Any rate, I'm here to, this is an annual renewal. I've come before you and the committee each year for as long as I can remember. The reentry project in Albany County, we're one of 20 counties statewide, and we provide services for returning citizens from New York State prisons that are on parole. And the contract renewal is for $220,000, give or take, of which a portion we subcontract out to a care management agency, which will be the next item, I think, on the agenda. But this request is to allow us to renew an annual contract with the Department of Criminal Justice Services for reentry services.
Thank you, Dr. Giordano. Do we have any questions from the committee? Hearing none, can we get a
Chairman
motion?
Joyce, I'm not on the committee, but I have a question.
Go ahead, Mr.
Dr.
Graham.
Giordano, how successful, if the goal here is to keep people from committing more crimes, are we
Well-
tracking that, and how successful are we doing?
Yes, and I was expecting your question and appreciate it. So the measure that the state uses, and that I think is a good indicator of your interest, it's recidivism, and it's rearrest within the time period that we have them under our care. And the numbers for 2021, which are our last numbers, is that we have a 73% success rate, or conversely a 27% recidivism rate. And we compare that to the rest of the state average, which is a 36% recidivism rate of the other reentry programs that I identified, 19 other ones. So by all measure, we are meeting the target that the state has set out for us, which is rearrest. Your subtlety there about committing crimes, sometimes people commit crimes and they don't get caught, and we have no real knowledge of that. But by measuring reincarceration, I think we're providing a service of value to the county.
So you're doing better than the state benchmark, is what I'm hearing.
I'm proud to say that so far, yes.
But how's the county doing? You said since 2010 we've been doing this, so I'm
Oh,
curious.
I just gave you the 2021 numbers. I'd be glad to submit the full. We've been doing this for over 20 years. Each year we have been very similar to this in terms of comparison to state average.
Okay. Thank you, Dr. Giordano.
Yes, sir.
Thank you, Chairman Joyce.
Thank you, Mr. Grimm. Any further questions for Dr. Giordano on number 8? Hearing none, can we get a motion to move?
Make a motion.
Motion made by Mr. Beston, second by Mr. Reedy. All in favor?
Aye.
Any opposed? Unanimous. Excuse me. Number 9, authorizing an agreement with Rehabilitation Support Services Incorporated regarding case management services for the reentry program.
Yes, sir. So the next step in our program is to work with a local care management agency. In this case, it's Rehabilitation Support Services, and $125,000 of the total contract that we have with DCJS goes to RSS. This is their second year of operation. They hire 2 case managers that work exclusively with the returning citizens on parole from state prison. And the metrics that I just cited are both a function of our County Department of Mental Health efforts as well as the case management from RSS.
Thank you, Dr. Giordano. Any questions on number 9? Any questions from the legislators on number 9? Not on the committee. Hearing none, can we get a motion to move number 9?
I'll make a motion.
Motion made, Mr. Reedy, second by Mr. Best.
well.
All in favor?
Aye.
Aye.
Any opposed? Unanimous.
Thank you, Mr. Chairman. Thank you to the committee. Good evening.
Thank you for joining us, Dr. Giordano and Ms. Witherspoon. Have a great month, and can we get a motion to adjourn?
Motion.
Motion made by Ms. McLean Lane, second by Mr. All in favor?
Aye.
Aye.
Unanimous.